Hi, my name is Dr. Gauri Bhede. I'm a medical oncologist and I work at a teaching hospital in Boston. While I'm not personally responsible for taking care of COVID 19 patients, my colleagues are, and I've personally experienced how much this COVID 19 pandemic has changed the functioning in our hospitals. Since we started the isolation and social distancing, I still went to work, and it was only when I had a few days off that I realized how difficult it has been for those of you, and that means mostly all of us, who have had to stop working in our offices, stop going to schools, and conduct our entire business uh, online and from home. So I came back from my tour of duty in the hospital, and I thought I would have my space to do my work, and discovered that every other member of my family was also at home. And each of them had already carved out their space to do their Zoom calls or their homework. And we were pretty much all competing for the same space that we would need to conduct our school and office work. We keep hearing about how we need to flatten the curve. What does that mean exactly? It means that we want to quickly decrease the number of new cases getting infected and getting sick all at once and overwhelming the medical system, because we don't have the means to take care of all of them if they peak all at one time. So, if we can use social distancing to decrease the number of new cases getting infected and push out that curve to a later point in time, that would help us deal better with this crisis. We would flatten the curve and spread out the pain. What are we being asked to do? Firstly, we are being asked to please, please, please stay at home. Uh, it's really vital that we follow through with this. Like I said, we may not know we are infected, and we may inadvertently and unwittingly pass this on to other vulnerable people in our family as well as friends and neighbors. So please stay at home and follow the rules. How you can protect yourself is by vigorous hand washing using soap and water. If you don't have access to soap and water, uh, most certainly using sanitizer is an alternative, especially when you go in and out of marketplaces or open doors. Make sure to sanitize your hands if you can't wash off the virus right away. The next most challenging step is to not touch our faces. I have discovered it is really, really challenging. It is so easy to continuously adjust where your glasses sit on your nose, to have that itch, to move that strand of hair, or to scratch your ear. And these are all things we do subconsciously. And maybe if we could just all walk around with those little dog cones, we would avoid touching our hands and faces. I mean, our hands to our faces, but we don't. So, is it really useful to wear a mask? I think the purpose of wearing the mask is to remind you not to touch your face. By the way, I'm touching my face right now because I've washed my hands and I haven't touched anything that might be contaminated. Because we're all sitting at home, we're also really being affected by the social isolation. People have reached out to friends and family across the globe by means of using Zoom or FaceTime, and have continued to be in touch with their friends. Since we now have time, we are at home after we finish our work, we can be connected by social media and through web based products. One way to be neighborly is to check in on your friends and neighbors to see if they need anything. Since we're all trying to minimize our outside exposure, if one person is making a run to the grocery store or the drugstore, maybe you can pick up things for other people and drop them off at their doorstep. There are also elderly people who shouldn't be out and about where they are at risk for picking up infection, and it would be nice and neighborly to drop off their groceries or their medications at their doorstep instead of having them make a grocery run themselves. So it's very tempting to go out to a park and play. Again, it a lot of the activities we might indulge in at the park may involve touching an object that an infected person may have touched, and so it's best just not to do it. I have to confess that I sneaked off with a friend to a tennis court in our neighborhood, and we thought, what harm can it be? We're across the net. She's, 25 feet away. All we're doing is touching a ball. And we thought we could even not touch the same ball, just write our name on the ball and only use the ball that our name was on. But the city had put up a police tape across the entrances to the tennis courts, and we do have to respect that because it may be that I'm being careful, but if somebody else is not being careful, I don't want to spread the virus. So we quietly went back home, and what I have done is to string a clothesline across my backyard and just hit the tennis ball across that clothesline with my son. Other ways of exercising are basically just to take walks because you can keep your social distance with from anybody else, which is a minimum of 6 feet, and or just take solitary walks. We have a lot of people in our community who are really suffering because they have lost their jobs and basically have no means of continuing to provide food for their families. And this is certainly something we are blessed to be able to help them out. And in our community, we have a lot of micro pantries around the neighborhood, and we can keep them stocked so somebody can come and pick something up when they need it. So, my suggestion to you as we weather this perhaps long and hopefully not so long period of isolation is to create a space in the house that you can do your work and then also take care of your physical and mental health. Make sure to get that exercise even in social isolation. Go for walks, use some weights, take care of your mental health, reach out to friends and family. There are so many resources on the web and on YouTube that you can carve out an exercise program as well as perhaps a meditation program or a yoga program and practice. Do yoga practice to continue to support yourself during this period of isolation. Take care of your nutrition. If you have access to fruits and vegetables, that would be optimal. And if not, then you can at least support your body through vitamins, some micronutrients, which would be important to boost your immunity, like zinc or selenium, and make sure the foods that you are eating are good for your body and your immunity. For example, if you can add a cup of green tea or turmeric, you can decrease the inflammatory process and make sure to eat fresh greens if you can. We are in this for the long haul, but we're all in this together. So take care of yourself and be well.